We are here this morning at the virtual hospital on the Grand Strand Campus where these nursing students are experiencing real-life situations. After they look over the morning's orders and review the patient's history and treatment, they proceed to the hospital bed. Before they enter the room, they must put on their gloves. Each student is given a role. A primary nurse has been assigned, as well as a medication nurse, a treatment nurse, and a documentation nurse. The sim lab coordinator leads them through the morning's exercise.
Can you wiggle your toes for me?
No.
You cannot tell me squeezing your toes.
So we are focusing on this like something's wrong. He's hurting because of this. You guys agree?
Yes.
Now let's see what we can do for him. Let's see. Is it positioned the right way?
No.
Okay. Could that be a problem when you're post-surgery?
I would think that it should go.
Okay. Anything else you think is not right? There is no pulse. Change in color is happening. What could cause or trigger your change in color and no pulse when you have this dressing on his legs?
It could be too tight. He's not getting us.
How do we assess for that? So with what we have done, he is still in pain. So
We should administer some pain medication.
you want to go that way now?
Yes.
So talk to your medication nurse.
Medication. He can't have morphine because I was given at 8:30.
Room.
We can reposition him.
Okay. Has anybody seen a nurse give this medication? Yes? No? Okay. This is where it goes into. This is what the nurses take with them when they go to the hospital. A carpule goes in this little gadget. It sits in there. Okay? And then you twist this little blue thing to lock it. Plus also you screw the plunger into the screw in the medication and then you're ready to give.
Okay.
This does not need a needle. This goes into a blue port. So go to that side because that's where we have our IV.
Before the medication nurse gives the meds, she must follow the safety check.
Let's do it.
What's your name, sir? Your date of birth?
Okay, James Moore.
Your date of birth, sir?
James Moore. July 30, 1970.
It's all right? Okay. So we've done our safety checks, right? Does he need to be flushed? Does he have an IV line? Is IV fluids going in?
Yeah.
So does he need to be flushed?
No.
No. Good. Okay. When should you flush it?
When it's not hooked up to
When
IV.
it's saline locked.
Yes.
Okay. But this we know it's running continuously, so we don't need to flush it. Okay. Let's go ahead and do safety. Okay. We have safety for the tubing. No. Let's do safety for the tubing and guys, I want you to see how it's attached to without needle. You go for the blue port.
Right.
If I were the patient, I'd like you to like give me that
Sure
dose.
you would.
But should you do it?
No.
That's the only way it works.
At this point, the student nurses are asked if they've done everything possible for the patient. It's decided that the documentation nurse needs to call the doctor.
He has.
I thought it was Stewart Moore.
It is James Moore. Mr. James Moore.
I do not have the whole day to talk to you. What do you need? What's happening? Who's my patient?
Mr. James Moore. He's in room 231.
Oh, you're in the hospital
Yes.
then? Okay. What's wrong?
He's complaining of extreme pain. We've
Where is his pain?
in his right lower leg.
He is the guy who had surgery yesterday?
Yes.
But he should have pain, right? Why are you
Yes.
calling me?
We've done everything we can to help him, and nothing is relieving his pain.
What have you done? Tell me.
We have administered morphine. We have changed his position. We have removed the pillows from underneath his leg.
You did not touch my dressing, have you?
We did remove the.
You should not have done that.
We didn't remove the dressing.
Okay, so what did you do then?
We just relieved some of the pressure by taking the bandage off, but
So that should have helped him.
it did not, and he's still complaining of pain.
Oh, you're telling me you did everything that you have done and he is still in pain?
Yes.
So what do you want me to do?
I would like you to come assess him and check his
But you have assessed him, right?
check his wound that we can't touch.
Tell me what you see with the leg. I can't go there right now because I'm prepping for surgery, and this is an emergency surgery, so you need to tell me what I need to do. And I have 2 minutes for this.
The hemovac is not draining,
Okay,
and his toes are blue, and they're very cold.
so that's a good thing you took his dressing off, the wrap I mean. You released the wrap, right?
We did release the wrap.
You gave him some morphine, it didn't
Gave
help.
him morphine. We
What do you
breathed-
think I need to do now?
if you can come assess his wound?
Okay, I can't be there right now. I'm gonna have my other partner come in. He's gonna be there in 5 minutes. Keep him comfortable. Check his vital signs. We probably need to go into surgery again. Anything else?
That's all, thank you.
Thank you.
Well, as we all were watching that exercise, there was no question about being nervous, but how did you feel during that conversation with the doctor on the phone?
I was very nervous. I felt like I was being drilled and I didn't have all my facts together, and so I felt as I was giving answers that they weren't good enough, and I had to keep coming up with new things to tell him, and I was very nervous.
We all saw that, yes, definitely. All right, so what are you going to do next time different to make yourself feel better?
Making sure I have everything together and I can give him clear information quickly.
Sounds good. When this exercise is complete, the students assigned to observe give their critique and assign a grade to the process.
Everybody did hand hygiene and safety very well. You identified your patient multiple times. You checked the bed rails and you caught that it wasn't locked. Let's see, when you all started your initial assessment, you immediately switched to a focused assessment once the patient started complaining of pain. Well, the 5% that we decided to collectively knock off.
The Sim Lab coordinator, Nancy Afeder-Wayos, tells me how these students were prepared for today's exercise.
Even before they came in, they were provided with pre-care materials regarding the cases that they could possibly have and then research on it. We also give them websites that are credible, that they go in. These are very animated websites that they can watch and view and listen and learn. So they are very much equipped when they come in, and then that continues with the pre-care where they learn more about specifics. So the students are not just pushed into a situation where they don't have a clue what they need to do. They're prepped as much as we can, and then have them go through the scenario, because if it's unpleasant, then they won't learn. Our main objective here is to get them to learn nursing in a so different way where they appreciate it and feel more comfortable going in that room, because we try to get it as realistic as we can with all the props. But it's not just the mannequin that does all this. The mannequin is just part and parcel. It's the preparation, the discussion, the teamwork, and then the mannequin just adds to it.
She also explains the compatibility of the patient responses.
You can program him to say whatever you want to, but it has a preset list of words and statements. You can have him breathe. You can change lung sounds. He has a heart sound and it can be changed. He has vowel sounds. He has pulses, and it all can be programmed to change. We can stick an IV on his arm. We can insert a chest tube in his chest. We can do anything we want to do. There is though some more that we're going to get from the Georgetown hospital system. When that comes in, it can react. The pupil reacts. It changes in size. There is color change. It can get cold. It can get warm. So really, we are in a very high-tech learning system that students benefit from it.
After a break, new assignments will be given and another patient will be assessed in the virtual hospital. For Techknow, I'm Lacey Rudolph.